Handling dental emergencies, first aid tips for common issues. When it comes to dental emergencies, knowing what to do in the moment can make all the difference. Whether it's a sudden toothache, a broken tooth, or a knocked out tooth, being prepared with the right first aid tips can help alleviate pain and prevent further damage. In this video, we will cover some common dental emergencies and provide you with the necessary first aid tips to handle them effectively. 1. Toothache. A toothache can be caused by a variety of reasons, including tooth decay, infection, or injury. If you experience sudden tooth pain, here are some first aid tips to help alleviate the discomfort. Rinse your mouth with warm salt water to help reduce inflammation and kill bacteria. Use dental floss to remove any trapped food videos that may be causing the pain. Take over-the-counter pain medication to help alleviate the pain until you can see a dentist. If the pain persists or is severe, it is important to see a dentist as soon as possible to address the underlying issue. 2. Broken tooth. If you have a broken tooth, it is crucial to act quickly to prevent further damage and infection. Here are some first aid tips to handle a broken tooth. Rinse your mouth with warm salt water to clean the area. Save any pieces of the broken tooth and rinse them with water. Place them in a container of milk or saliva to keep them moist. Apply a cold compress to the affected area to help reduce swelling and alleviate pain. It is important to see a dentist as soon as possible to assess the damage and determine the appropriate treatment. 3. Knocked out tooth. A knocked out tooth is a common dental emergency that requires immediate attention to save the tooth. Here are some first aid tips to handle a knocked out tooth. Hold the tooth by the crown, top part, and gently rinse it with water. Do not touch the root. If possible, try to reinsert the tooth back into the socket and hold it in place with a clean tissue or cloth. If reinsertion is not possible, place the tooth in a container of milk or saliva to keep it moist. It is crucial to see a dentist within 30 minutes of the injury to increase the chances of saving the tooth. 4. Lost crown or filling. Losing a crown or filling can be not only uncomfortable but also leave the tooth vulnerable to further damage. Here are some first aid tips for handling a lost crown or filling. Clean the crown or filling and try to reattach it using dental adhesive or temporary dental cement. If reattachment is not possible, keep the affected tooth clean and avoid chewing on that side of the mouth. It is important to see a dentist as soon as possible to have the crown or filling properly reattached. 5. Broken dentures. If you have broken dentures, it can affect your ability to eat and speak comfortably. Here are some first aid tips for handling broken dentures. Avoid wearing the broken dentures to prevent further damage to the mouth. Keep the broken pieces and bring them to a dentist for repair or replacement. It is important to see a dentist to have the dentures repaired or replaced to ensure proper function. In conclusion, knowing how to handle dental emergencies can make a significant difference in saving teeth and preventing further damage. By following these first aid tips, you can alleviate pain and discomfort until you are able to see a dentist for proper treatment. Remember, it is essential to seek professional dental care as soon as possible to address the underlying issues and prevent complications.